Okay, we're back from the break, and is Marvin still on the phone?
Yes,
Okay,
I am.
great.
Hey, what I did was I went in and saw your nurse practitioner.
Okay.
What is it, Goodhart?
Yes.
And I had 30 milligram morphine
Okay.
that I had take before for kidney stone. I didn't really get into taking them because one time I took it, it made me goofy.
Correct.
And I don't like to lose track of my body control, you know what I mean?
Oh, absolutely.
And I'm goofy enough, so I don't need something like that. She suggested 15 milligram. Now, out of those 30, 15 milligram, I've taken 2 for this back problem. Is there anything else you can suggest? It's in my lower back and mostly on my left side that I get pain.
And you want to know if there's anything besides the 15 milligram morphine that you might be able to take for that?
Yeah, without making me goofy.
Have you tried a non-steroidal? Like, can you take Aleve or Motrin or products like that?
I've taken Aleve when I have chest pains. When I get out in the yard or work out, I get muscle pain. And I take so many Aleve. I experiment before I take, starting off with 2 and maybe progressing. I go up to a certain amount before I go to bed, and I get rid of that chest pain. But I haven't been able to get rid of the back pain through Aleve, and I don't like to take Tylenol or any of those others that I have tried a long time ago and they didn't work. And that Motrin, or what you said, I tried that a long time ago too, and that doesn't work very well on muscle pain.
Marvin, are you using any ice in the evenings before you go to bed?
Ice?
20 minutes of ice.
No, I'd be a little concerned about that because I work. What I do is I found that heat. I get in a shower and I bend over, turn the hot water on as high as I can, stand it, and I kind of move back and forth, letting the water pitter-patter on my back, in the middle of my back, down to my butt, and that seems to help me all day long.
Yeah, but you're talking about going to bed at night. Once you put that heat on there, as long as you're moving, then you're working with the inflammation in the joint. But when you get in bed at night, you're not moving, and you still have all that inflammation. You got to do something about the inflammation in your sacroiliac joint and your L5S1. I would just have you try this. I have my patients use frozen peas or corn or even a chicken if they don't have an ice bag. But I would go to ice. I would try it 20 minutes an hour for a couple of hours before you go to bed.
Okay, I'm willing to try that.
And see if that doesn't take some of the inflammation out of there. Are you able to do any stretching at all, Marvin?
Oh, yeah. Oh, yes, I do.
Okay.
That's very important is before I get moving around outside doing yard work. Yes, I bend over, do stretching. I turn left and right like I did in the service. I try and do some of those exercises that they had me doing. That seems to help.
Very good.
The other thing, Marvin, is there are a few compounding pharmacies around in Vegas that make up something that sometimes is a little bit better than just plain Voltaren gel. Mm-hmm. They'll use a little lidocaine with pilocarpine, with topramate, and gabapentin, along with meloxicam, which is a preparation that in a vehicle that can penetrate into that area, so that you may be able to topically apply that. And that might be something you could do in the evening too, to soak into those joints to try and help give you a little additional relief without having to take an opioid or anything like that. And I would be concerned about this history of chest pain with activity and chest pain at night that you're taking a lot of Aleve for, because are you sure it's not cardiac?
I had a ruptured aneurysm, and I had it fixed in Las Vegas. And when they examined me, they said my heart, all my lungs and everything were perfect.
And how long ago was that?
2015.
Okay. Well,
No, as long as I don't go out raking, this is where I get muscle pain in my, I use the expression breasts.
Well, no, that's fine. You can have musculoskeletal pain in your chest. It won't kill you, but cardiac pain might. So that's why I needed to know with that history of you're saying you're outside and you have to take a lot of Aleve to get rid of the pain. I just wanted to make sure it truly was inflammatory as opposed to vascular type of, atherosclerosis. So, but if you've had a full cardiac workup and they've looked at your arteries and they've looked at your valves and your heart and everything's squeaky clean, then I would just be concerned about developing an ulcer or a renal impairment as a result of taking a lot of nonsteroidal. So you have to be careful of that. And then once you've embarked on that or develop an ulcer or develop a problem as a result of taking those nonsteroidals and please don't mix cortisone with a nonsteroidal. Those can lead to almost 90% GI bleed. So, and if you bleed from your gastrointestinal tract, number one, it could be fatal. Number two, it would pretty much preclude you from using a anti-inflammatory for a very, very long time, if not forever.
Yeah, well, I know about taking too much aspirin, what it can do to your stomach lining. I don't take aspirin.
Yeah, but the nonsteroidals work through a different mechanism, Marvin. What they do is they impede, okay, so pain in our body is mediated by substances called prostaglandins, okay? There are good prostaglandins and bad prostaglandins. The good prostaglandins maintain our stomach lining and our renal blood flow. When you take a non-specific prostaglandin inhibitor like Motrin or Aleve, you inhibit the good prostaglandins and the bad prostaglandins together. So while it doesn't just erode into your stomach like an aspirin does, it will slowly denude this protective lining that your stomach makes from the acid. And once that happens and it denudes it and weakens it, then you can develop a bleeding ulcer. It's a different type of ulcer than aspirin related.
Okay, is that some kind of blood thinner?
What's a blood thinner?
Well, what you're talking about.
Prostaglandin? No. Prostaglandin is a chemical that our body makes.
Oh, okay.
And when we injure ourselves, prostaglandins are released that mediate pain. They irritate our nerve fibers. They basically cause different blood flows, but they mediate pain. But then there's prostaglandins that are good prostaglandins, one that keep our blood flow to our kidneys open and one that help protect our stomach lining. So what I'm saying is Motrin doesn't care whether or not it's a good prostaglandin or a bad one. Mm-hmm. So you take a lot of Motrin over time, you're going to inhibit the good prostaglandins, but you're going to get pain relief, but all of a sudden you're going to develop a bleeding ulcer or you're going to develop some renal failure.
Well, that's why I don't like taking prescription medicine. I always, when anybody prescribes it, I call a pharmacist and I will talk to them because they know a lot about what problems can come up by taking that stuff.
Oh, I agree. They have a lot of good information, but I'm just telling you, long-term non-steroidal use is not very good, okay? So we can go the topical route, the exercise route, try the ice route, maybe some compounding to help some topical stuff, and as little Motrin as you can get by with to help you be comfortable, okay?
Yeah, well, I don't take Motrin. I don't have it. The only thing I do have is that Aleve and
there's no difference, Marvin, there's no difference between Aleve and Motrin. There's still, one is naproxen, one is Motrin. There's a few little chemical differences, but they're basically the same non-selective, non-steroidal inhibitor, okay?
Yeah, rather than take up your time on the phone here when other people are trying to get in, how are you fixed for patients? I'd like to see a good doctor, which, I was seeing Reiner. Mm-hmm. I go to the VA, and VA is not very helpful. I see a doctor there, but she's, like I said, she's not very helpful. It took me a long time to get this CT scan over here at the hospital.
Well, listen, I mean, you know, you can call that my number, and usually I'm about 2 to 3 weeks out for an appointment, and I'll be seeing patients over at Creig's clinic, which may give you a little bit better access. So why don't you, you know, give me a call to 751-6111 number, and Cheryl will try and squeeze you in, not this week, but next week.
Yeah, well, I haven't had too much luck on getting an appointment with you. That's why I'm asking you about, are you really that busy?
Oh, I'm very busy, but I'm just saying I'll get you in at the end of the day if you just tell Cheryl that you talked to me on the TV show, okay?
Yes, okay. I appreciate any information you've given me. I like my body. I'm 79 years old, still going strong, so.
Absolutely. I'm more power to you. Keep
All right,
going.
Thank you very much.
You're welcome, Marvin. Thanks for the call.
You have a nice evening.
Yeah, no, thanks for the call. And like I said to the viewers out there, there's a lot of good information there about, you know, because there isn't one of us at one time of our life isn't going to suffer from back pain. You know, there's a lot of good things you can do that are non-medicinal, that are supportive. And we joke about it, but people go to your office feel better because they get, you know, stimulation, they get a little heat, they get ultrasound, they get touch, they get to feel better. They come to my office and, you know, they wait an hour and a half and then they get a prescription and they go home and they don't feel like they do when they go to him. So we're going to go to break. We'll be right back. Thank you.